Hi, my name is Melina Kibbe from Northwestern University. I was really happy to moderate a session that was called The Next Best Thing in Cardiovascular Sciences. This was really a lightning round session where representatives of each one of the American Heart Association councils presented on what the next best thing is in their topic area. Here's a sample of some of the exciting talks that we heard.
I'm pleased to talk about the next big thing in clinical cardiology. And we're very fortunate in clinical cardiology to have made tremendous advances in understanding cardiology diseases and conditions and in developing lots of new effective treatments for clinical cardiology. What is the biggest opportunity now for improving care for patients with cardiac disease is simply in better application of what we know is effective. And so that's what I'd like to focus on is the next big thing, because we have tremendous opportunity. And in fact, there are still large gaps in how we're applying treatments that we know are effective and yet are a challenge to apply. And I'll use two examples of where we can take some principles of needing information technology, electronic medical records, measurement and feedback, and then implementation strategies to improve how we're applying care. One of those is in improving reperfusion care for STEMI, and here we have Mission Lifeline as a great example of this. And we still have lots of opportunity to further improve care, particularly in coordinating emergency medical services and hospital care, and in the transfer process, transferring patients from a non-PCI to a PCI center in a timely way, where we still see that only about half of patients, or maybe less, are treated according to guideline standards. And we know that this can be done, and Mission Lifeline provides a template for how to do that. The second example is in atrial fibrillation. For atrial fibrillation, we know that patients who have a risk factor for stroke and who have atrial fibrillation, who have proven benefit from anticoagulation therapy, that only about half of those patients are on anticoagulation, and that there are something like 50,000 strokes a year, therefore, in the United States that could be prevented if we better applied anticoagulation care. And to do this, what we need to do is have ways at a health system level to measure who is it who has atrial fibrillation and risk factors for stroke, and who is being treated, and for the ones who aren't being treated, why not, and how can we intervene to assure those patients are on effective treatment. And there are some very interesting pilot studies going on that are addressing this issue that I think will make a large impact on improving cardiovascular care. So those are some of the applications of this big idea of how can we take a systems approach to better applying proven effective treatments for cardiovascular disease.